coming along to today's In Conversation event with Jonathan Ashworth. It's been a great 2 days of the Fabian Society New Year Conference. We're meeting in a very different way to our usual gathering. We are virtual, but we're still remaining connected. This event will be a discussion with Shadow Health Secretary Jonathan Ashworth. And we're going to spend the first 25 minutes. John and I will have a conversation. Then I will open up the discussion to wider questions from those of you in attendance. If you look on your screen, you will see a question bubble with a question mark. If you click on that, you can type in your questions. You may potentially be called upon. And if you are, just click the video and microphone button and we'll get you to deliver your questions. So let's start. So, it's a really difficult period. In addition to being chair of the Fabian Society, I am a NHS GP and clinical director for North Newham Primary Care Network, working on the front line in this pandemic. And with over 3 million cases in the UK and 86,000 deaths, the coronavirus pandemic is without a doubt one of the biggest challenges our nation has faced. Since March last year, we've seen various missteps from the government, from the equivocations around when to introduce lockdown in March to the failure of the test, track and trace system. You speak to government ministers, they state that, what we're seeing now was inevitable, couldn't be foreseen. The question is this down to poor decision-making? John, I just want you to reflect on the last year and the extraordinary time we live in. Was this inevitable or was this just poor decision-making? John?
It wasn't inevitable. It didn't have to be like this. But can I just start by thanking the Fabians for inviting me to offer a few reflections on this Sunday afternoon, and to thank you, Martin, for everything that you're doing on the front line in our National Health Service, for the work that you're doing in Newham. And I want to thank all our NHS staff and our social care staff. I think this crisis, this national emergency, has reminded us yet again. I say reminded, I'm sure many of us never forgot. I certainly hadn't forgot. But it has shown the nation yet again of the brilliant resilience of our NHS staff, that they're always prepared to go that extra mile. And it has brought home to us again the value of a national health service, where health is, and it must be, in my mind, a human right, and where health must be provided universally, publicly provided, free at the point of use for all. And we as a nation have come together and we've clapped our NHS staff on our doorsteps, and we've painted, or our children have painted rainbows and put them in our windows. And I think that appreciation for our NHS staff, this is such a big moment for our NHS. And I think you've seen it today, and quite starkly, because we know that our National Health Service is under the most intense pressure that it's ever been under in its 70-odd year history. Is a sense of national crisis. There are more in hospital now than in the first wave, more in our intensive care and on ventilation than in the first wave. We've got ambulances backed up outside hospitals. We've got routine operations for knee replacements, hip replacements being delayed. We've got cancer screenings and cancer treatments postponed, scans and checkups being delayed, which means many will probably develop a serious illness in the future. So we can see the intense pressure that our NHS is under. We've because of the nature of dealing with COVID, where you either have to have a machine to breathe for you through ventilation, or you have to have a mask to help you breathe. We've got hospitals running out of oxygen supplies, or warning that they may run out of oxygen supplies, I should say. This is unprecedented. But you can also see the tremendous ability of our National Health Service to carry out a national priority on a scale that we've never seen before, probably since wartime. And I'm talking about the vaccination, because today we've actually now vaccinated more people in this country than we've had recorded cases of COVID. So roughly 3.5 million people now vaccinated with their first dose. This is a 2-dose program, of course, but that's actually more than the 3.3 million recorded cases. There's probably been more cases in reality in the country, but recorded cases. I think that's an amazing achievement on behalf of the National Health Service. And I just think, isn't it reassuring that our National Health Service is in charge of the vaccination program and not Serco, because we've seen the disaster of Serco throughout this. So was this inevitable? No. I mean, the United Kingdom's response to COVID has been unforgivable, I believe. 86,000 dead. We are on a trajectory for 100,000 dead. That's 1 in 660 people across the country. These are horrendous figures. And it didn't have to be like this. But it's a number of factors have got us here. So yes, Boris Johnson failed to follow the scientific advice when he needed to. He locked down far too late. It's always locked down. On all 3 instances, the first lockdown, March, April, the circuit break lockdown in November, the lockdown this January, he went in there far too late. When we've been in the crisis, he's not put in place the measures that were needed. Early on, he failed to get the PPE to the frontline NHS staff. He actually abandoned contact tracing on 12th of March. And when he realised he had to implement a contact tracing regime, turned to the Sercos of the world, who've delivered a poor, hopeless response. We've only now put in place border controls. Our first recorded case in the UK was the 31st of January. It's taken him 12 months to put in place border controls. I mean, for a party and a Home Secretary, particularly in Priti Patel, whose whole campaign for Brexit was to take control of our borders, it is calamitous beyond imagination that they failed to put in place border controls when the whole point of their Brexit campaign was to take control of our borders. They've still failed to put in place decent sick pay for people to isolate themselves. And even though we're in a lockdown, there are still 10 million people who have to go to work. They're failing to put in place measures to make workplaces COVID secure. So yes, their response to the pandemic has been characterized by calamity after calamity. But it's not just about their response. It's also because going into this pandemic, the fundamentals that should have been in place to protect us had been stripped away because of 10 years of austerity. We went into this pandemic with our public services depleted, and short of 100,000 staff in our National Health Service, and short of 15,000 beds cut in our National Health Service. And because of 10 years of reorientating the tax and benefit system away from the poorest and most vulnerable and in favour of the richest, and because of wider cuts across society, which has seen inequalities widen, it means we had less health resilience going into this pandemic. We went into this pandemic with life expectancy stalling for the very poorest in society and health inequalities getting wider and wider. So yes, the response of the government in day by day has been calamitous and poor, but 10 years of austerity meant we were hindered in our ability to respond to the pandemic sufficiently. I mean, our public health budgets have been cut. Too many of our elements of the National Health Service have been privatised and outsourced. So we were not as strong as we should have been. And I just want to, so that is the response, but I want to make a sort of broader point, because when you look at what's happening with this pandemic, I believe that what actually we are now seeing is the interaction between 2 epidemics. You've got the epidemic of COVID, or the pandemic of COVID, but then you've also got the epidemic that we've been grappling with and haven't tackled properly, which is this growing burden of chronic disease, this growing burden of non-communicable diseases, which tends to cluster amongst the poorest and disadvantaged in society. So when you look at the figures, it is those with long-term conditions, diabetes, blood pressure, cardiovascular, hypertension, who are most at risk from this virus. And those, if you're living in poorer areas, are more likely to suffer from these long-term conditions. And what you've got is, you've got the two, and that's why it's two epidemics interacting. You've got COVID exploiting these health inequalities, and these health inequalities making people more vulnerable to COVID. And then on top of that, of course, the cruelty of COVID is that it thrives on social interaction as well. And it's often the poorest in society who still have to go to work, and who do not have the advantage of working at home on a laptop, on a Zoom call, whose very nature of work means that they are mixing more socially. And then often, because of the circumstances of their means, often means they live in overcrowded housing as well. And so they are more exposed themselves, and then they expose their families. And a lot of those communities are from poorer backgrounds, and we've seen disproportionate. A lot of those communities are from are poorer. Those communities are poorer, and we've seen disproportionate deaths amongst poorer people. And a lot of people working in those jobs are from Black, Asian, and minority ethnic communities, and we've seen a disproportionate impact on Black, Asian, and minority ethnic communities as well. Tragically, in the death figures, particularly in this second wave amongst Asian, Pakistani, and Bangladeshi communities, particularly, but it's impacted different communities in different ways. So I think what then must our response be? And I'll finish on this point because I know I'm going on a bit. I think there are three big challenges now which come out of this. The first challenge is, how do we tackle these health inequalities, and how do we secure or maintain the health of every individual? That has to be the first challenge. The second challenge is the ongoing challenge of an aging society. We've debated that through seminars and Fabian conferences year after year, but that is about, if you've got an aging society and at the same time growing health inequalities, how do you structure your health and care services to meet that? How do you get the staff? But also, you have to adopt a health in all policies approach and understand that every policy intervention has to be driven by improving health, because none of these issues are self-correcting. And the third point, which I just want to finish on, is this. It's about health security. I don't say this as a criticism of the Fabians, because I include myself in this, but we've always, all the debates and seminars in Labour health policy discussion in recent years has been about chronic disease and an aging society, and they need to be tackled. But I cannot remember ever, ever coming to a Fabian event, or even myself going to another, engaging in this debate to discuss how we build health security against the threats of emerging infectious diseases. And yet, it is remarkable when you think about it, that in the last 10 years, we have had a number of pandemics which have swept the world. MERS, the first SARS pandemic, Ebola, Zika, they haven't all impacted the United Kingdom the way this one has. But those warning signs were there. And I think we've become a little complacent about it. And I include myself in this. I remember doing the first draft of the health manifesto for last year's, 2019's general election. I was sat in a coffee shop outside the O2 while my two little girls and their mum were watching Little Mix, and I sat on my laptop and wrote the health manifesto. Pandemic preparedness never featured in that. Other things did: health inequalities, mental health, cancer care, things I'm very proud of. But pandemic preparedness never featured in that. And yet, the world has seen a number of pandemics, and in a world of climate change, where global warming means mosquitoes can travel further, where rapid urbanization and deforestation in parts of the world will disturb more of the habitats of animals, where global warming means that permafrost is melting, the conditions where more infectious diseases can jump from animals to humans and spread across the world with rapidly, like we've seen with this one, becomes more of an issue. So I think you've got to protect the health resilience of your individuals, put in place a health and care structure that deals with an aging society, and we've got to do more on international health security now as well. And tackling climate change becomes a big part of that. So there are big challenges that we can draw out of this for the future, but none of this was inevitable. And I think if you put health as your priority at all times, I think you can develop a more resilient economy, and it is the right thing to do, because the basis of my socialism, and the reason I'm so passionate to become the Labour Health Secretary, it's the job that I want. I don't want any other job in politics, although I appreciate these things are always at the will of the leader, the whim of the leader, of course. Is that there surely can be no greater social injustice than the fact that people die sooner and get ill quicker in life because of poverty and deprivation. We have to do something about that, and that's what my politics are all about. So that was just a quick run through of where my thinking is. Well, I say quick, I probably went on a bit, but that's a sort of run through of where my thinking is, Martin.
Thank you, John, for that really robust analysis of how we've gotten to where we are today. You've been Shadow Health Secretary since 2016, and back in July 2018, you edited a Fabian pamphlet, A Picture of Health, where you talked about some of these issues, about how we can build a better funded, organized healthcare system. I just want to draw upon some of the things you mentioned in your opening remarks. You talked about two epidemics occurring. As we know, the COVID-19 pandemic has had a disproportionate impact on poorer communities, Black, Asian, and minority ethnic communities. And if you were health secretary today, what would you do to help to mitigate the impact of the pandemic going forward on those vulnerable communities?
I think the immediate, the big urgency at the moment, I think, in the pandemic, is the need to protect those who still have to go to work. There's a big proportion of people who are being forced into work, and I don't believe they should be forced into work. And the government need to enforce a stay-at-home message and tell those employers that they should furlough their workers. But there is 10 million key workers in this country who work in public services, who perhaps work in food chains, whether that's supermarkets or food manufacturing, or other vital bits of manufacturing, who are key workers. They have to go to work. They have to get on, not always, but often get on public transport to go to work. They're often poorly paid, and often live in overcrowded housing. And often in public services, particularly in health and social care, a large proportion are from Black, Asian, minority ethnic communities. So we need to insist that those people who still have to go to work through this lockdown are properly protected. That there is proper, if they're in health and social care, that they're getting proper PPE. And there's a debate around, given that the current virus is more infectious, between 50 and 70% the new B117 variant, whether there is a need for better, more adequate PPE for those across the wider health and social care workforce, not just those working in ICU. We need to ensure that workplaces are properly ventilated. We need to make sure that distancing is mandated in workplaces. And crucially, for those who are ill, they need to be given proper sick pay. I mean, SAGE itself has warned that only around 20% of people are isolating, quarantining themselves. And the truth is, if you're low paid, or if you've got extended responsibilities, it's very difficult for you to isolate yourself if you're not going to have any recompense for that isolation. And so this lockdown that we're in at the moment has got to do two things. It's got to really push down, it's really crunch down infection, because if it doesn't, our NHS will be completely overwhelmed. It's pretty much on the brink as it is. But if it doesn't completely push down infection, we run the risk that there is a further mutation in the virus, because the virus is fundamentally opportunistic. And if there's more virus circulating, there's more opportunities for the virus to mutate, for a greater variant to emerge. Now, we hope to God, of course, that a further variant does not evade the immune response to the vaccine, but it's entirely theoretically possible. So you've got to do everything in this lockdown to break chains of transmission. And if you've got 10 million people who still have to go to work, they need to go to work in a COVID secure way. And those who need to isolate need decent sick pay. The second thing we need to do is roll out the vaccination at scale. If you vaccinate 30 million people, you'll reduce hospitalizations and deaths by 99%. That has got to be the target we aim for now. Because remember, the average age of somebody in ICU at the moment is 61. The largest cohort in ICU, I think, is, I was looking at the figures, I've not got it in front of me, but it's around 45 to 60, or 65, I think. I mean, I'll have to double check that, but the largest cohort is basically people in their 50s and early 60s in ICU. So we've got to go further in our vaccination efforts. And also, when we know, and I see this as, I mean, I live here, I'm here in Leicester, I live in Leicester, and people watching us will, I'm sure, be aware that Leicester is a wonderfully, brilliantly, fabulously diverse area. But you probably see this as well, Martin, in Newham, that there is a degree of vaccine hesitancy amongst some of our diverse communities. I see all kinds of nonsense spreading on WhatsApp and on Facebook. You know, and that's because of a whole lot of historic issues around vaccine distribution and of how vaccines have been used. But we've got to ensure that Black, Asian, minority ethnic communities are protected with vaccination, and that means ensuring that we have. Well, I've suggested to the government they have mobile units going into communities, but we obviously need a big campaign amongst in areas like Leicester and Newham and Tower Hamlets and so on to promote vaccine uptake, because it's really, really important that we protect people with the vaccine for the future. So those are the three things I would do immediately. The broader point I want to make, though, is that we're not going to defeat COVID just by the biological response of the vaccine, because it's endemic now. It's here to stay. I mean, we hope it's not here with these levels of prevalence and severity, but it's here to stay. So if you want to ensure your society is COVID secure, and if you want to successfully contain it as much as possible, you've got to deal with these health inequalities, because health inequalities mean people are more exposed and vulnerable to viruses such as this. So that health inequalities has to be a big overriding priority for health ministers. I suspect it won't be for these health ministers, but it would be for me.
So thank you, John, for those answers. Before we open up to the Q&A, I have one more question to ask you. You've mentioned quite a few things about where we are in the short term. This question comes in sort of two parts. First of all, what do you think has to be done in the medium to short term for us to completely get on top of this COVID-19 pandemic? We know that the government wants us to come out of lockdown, hopefully in mid-February. But what do you think, what key things do you think Matt Hancock needs to do to ensure that that is achievable? And if not, how long do you think, we may need the lockdown to go on for? And the second thing is the question in two parts. We know that the opposition and the Labour Party is under new leadership. You very much look like a government in waiting. As hopefully future Health Secretary Jonathan Ashworth, would you see as Labour's priority in the next Labour government potentially term? What would the priorities be around health? What three key things would you want to achieve in that term?
Well, first of all, I mean, I don't think that, given that the numbers who could still be in ICU, remember, there's people in their 50s and 60s who are taking up ICU beds. And I remember, at the moment, what you've got is you've got hospitals flexing up their ICU, using more ICU beds, but they are reducing down the number of nurses and staff who can care for each patient in ICU, because there's not enough staff. And remember, not only did we go into this crisis short of 40,000 nurses and tens of thousands of doctors and other key staff, there's actually around 50,000 NHS staff off sick related to COVID at the moment. So vaccinating NHS staff has to be an urgent priority. I mean, it's all I say. They failed to protect the NHS staff with the PPE adequately in the first wave, and now, as this second wave is ravaging, they're failing to protect NHS staff quickly enough by failing to vaccinate as urgently as they need to. So, what happens next on the lockdown? I don't think you can see significant movement until you start reducing deaths and hospitalizations by a greater number down the age ranges, which is why we've said to the government, let's have a big target for 30 million. If you do all those priority groups, you'll reduce deaths and hospitalizations by 99%. Let's get there. I think the manufacturers will supply these vaccines. I mean, at the moment, it's a bit lumpy and a bit stop and start. I understand that. It's early in the process. But as we get in the coming weeks, I think more will come on stream. And of course, there's other great vaccines out there. I mean, that can be used as well. There's the Johnson & Johnson vaccine, which will hopefully soon get the sign off. That's a 1-dose vaccine. There's another vaccine, which is a French company, which is manufactured up in Scotland, in Livingston, which people are very hopeful for as well. And so that's a vaccine that which shows, if you like, the strength of England and Scotland working together as part of a United Kingdom. So I think this vaccination rollout has got to be a big priority. And when we have more vaccination rollout, we can reduce some of these restrictions on our freedoms. But I come back to this central point. This is I believe it's two pandemics, two diseases interacting, COVID and this wider set of, or this wider category of non-communicable diseases, chronic conditions. And until you put in place real strategies to reduce health inequalities, you will never have COVID security. And on top of that, unless you act internationally, you'll never have COVID security, because you've got to deal with climate change, because climate change creates the conditions where more infectious disease can spread across the world. And you've got to play your part in ensuring the world is vaccinated as well, to be frank, because there can be no COVID security for us unless there's COVID security for all. And, it's great that we're vaccinating and, we're ambitious, and I'm pushing the government to go further. But unless you're vaccinating across the world as well, you always run the risk that there is opportunities for the virus to mutate further, which could come back and evade our immune response. What would be my priorities if I was fortunate enough to become the health secretary in a few years' time? Well, I think we will inherit a National Health Service with a huge backlog. So coming out of this crisis, this emergency, we're going to have a cancer crisis, because huge numbers of scans and checkups have been postponed and delayed, and cancer treatment has been delayed. We're going to have a massive mental health crisis. I mean, lockdowns isolate people, create the conditions where mental health problems fester, loneliness flourishes. We can see there's problems of addiction emerging, and we've already have problems of addiction, which I've spoken about myself and my own personal circumstances with my dad. I think we're going to have a real wave of mental health unmet need that is going to be needed, that's going to have to be responded to. And I also think we're going to have a child health crisis, because not only are children not in school, and we understand the reasons why, but we will have children, and we know that schools are doing their best to put on online learning and so on. I'm not knocking any of the teachers. I know they're working so hard. I've got 2 young girls at junior school myself. I know how hard the teachers are, but I think we know that children out of school for what probably the best part of a whole year is going to have implications for them. There's going to be implications for childhood obesity. There's probably a huge cohort of children who've missed out on their MMR jabs and so on. And, children cut off from their peers, isolation again, potentially huge mental health implications as well. So I think there's going to be a child health crisis we're going to have to respond to. They're the immediate things we have to respond to. But my priorities will always be tackling health inequalities and putting in place the structures to give people the very best health and social care. So healthcare, social care, publicly provided. Got to end all this wasteful privatisation. We've seen in this crisis the disaster when you outsource to the Sercos of the world. All that will come to an end under a Labour government. when I'm the health secretary. But the key thing, I'm sorry, going on, the key thing though, Martin, is that health and well-being is not just the responsibility of the health secretary. It's the responsibility of the education secretary with childcare and schooling. It's the responsibility of the housing secretary, because it's about the nature of the housing we live in. It's the responsibility of the employment secretary to ensure that people are not exploited in work. The responsibility of the pension secretary to ensure that people have decent support in the social security system. The responsibility of the environmental secretary to ensure that the air that we breathe is improved and the food that we eat is nourishing. It's the responsibility of the culture secretary to ensure that we have restrictions on the advertising of junk food and some of the things that we see on social media. So we've got to deal with all these societal pressures and commercial pressures that determine people's health outcomes. So health and well-being is the priority of a Labour cabinet, not just of me as a Labour health secretary.
Thank you, John, for those remarks. And it's something here at the Faith we've been advocating, that whole government approach to healthcare. I'm just going to now open it up to wider questions from the audience. Thank you for engaging in the conversation chat bar there on the side. Some really interesting conversations occurring. So we're going to take the questions in rounds of 3. Paul Richards, Jane Speedy, and John Smith, you're going to be sort of, you should appear on our screens shortly. Let's give a moment. If not, I will be reading out the questions. We'll just give a moment to see if they appear. I've been told they will sort of appear on the screen. And if you do appear, do press the camera and microphone buttons, because that's also needed as well. That's what's causing a bit of delay at times. So let's wait and see if they come along. If not, I'm there. Okay, so we've got Jane.
Yes.
Hello, Jane. So Jane, if you could deliver your question.
I'm upside down for some people, I think.
Oh,
but anyway.
Yeah.
I just wanted to know if you've got a strategy after the pandemic to have a sort of access to mental health services in schools, communities, workplaces. Is there a mental health strategy as part of this? I mean, is the future Labour government going to put in a mental health strategy all over the place? You talked about the whole cabinet being involved. I wanted to see mental health spread out across the whole of our society, really.
Thank you, Jane. And then the second question from John Smith was, how would Labour address the issue of 40,000 nursing vacancies? So how would Labour address the lack of nurses? So if you can take those two questions, John.
Okay. So in reverse order, I mean, John Smith's question is absolutely so important, because we did go into this crisis with a huge understaffing, under-nursing, under-doctored National Health Service, and we can see the implications of that, the consequences of that today. We've got to recruit more nurses. So we need to invest in training and training grants and support. I mean, one of the things that we were very, very angry about was when the Tories got rid of the bursary, and we campaigned against that, and we put it forward as a manifesto commitment to bring back the bursary. The Tories are have now U-turned and are bringing back a form of a grant. So we'll have to look at how effective that is. But my instinct is that we'll have to go further, and we'll have to invest in training places. The National Health Service, of course, has always relied as well on international recruitment, and there'll always be an element of that, quite rightly. But I think what we'll see though is that there is an international shortage for nurses. So just sort of assuming that the UK can just carry on importing nurses isn't realistic. Every healthcare system across the world now will be chasing nurses because of this huge shortage. So it's so important that we invest in training opportunities and expand training as well. And of course, if we're going to recruit nurses and keep people working in the NHS, because one of the problems is that we have vacancies open up when nurses leave. They get fed up of working in the NHS because it's too much for them. The pressures are too much. You've got to invest in those nurses. You've got to pay the NHS staff a decent salary. not freeze their pay year on year, and not begrudgingly pay them when you feel that you're forced into it. Pay people properly. And the second thing is invest in training and development. The training and development budgets have been hammered under the Tory government these last 10 years. And we should have an ambition that our NHS staff are some of the best trained staff possible. I mean, I want to be the health secretary who makes our NHS the best employer in the country. And that involves paying staff, investing in staff, and recruiting staff, and training opportunities for staff. Next, on the mental health point, this is Jane's point, is really, really important. Well, we take the importance we attach to mental, or care attaches to mental health, is symbolised, if you like, by the fact that we've actually got a shadow mental health minister who sits in the shadow cabinet, Rosanna Allen-Carr, who is actually quite a remarkable woman, because not only does she sit in the shadow cabinet, she's also on the front line in A&E caring for patients and being a brilliant MP for Tooting. I do not know where she gets the time to do it, but somehow she does. But you're right, Jane. Mental health, fostering good mental health and a sense of well-being cannot just be the responsibility of the health department, and nor is it just a clinical intervention. Mental health is also about, again, the quality of the housing that you live in, the nature of your employment, whether there is support for you, whether you've got access to green space. These are things that we have to tackle as well, and it's why one of the policy announcements I made in the last Parliament, actually made a Fabian conference in the summer Fabian conference. I actually came along and said we should put health and well-being at the centre of every single policy decision, but also we should have a Future Generations Wellbeing Act. So we actually have in legislation requirements to improve well-being, requirements to tackle health inequalities, because I think you need to give governments big goals to aim at. Gordon Brown and Tony Blair had a big goal of abolishing child poverty. I mean, if we'd stayed in government, we would have broadly abolished child poverty by now, 2021. We actually lifted 1 million children out of poverty, but that was because they set a big goal and a big target and enshrined it in law. I want to do the same thing about health, well-being, and health inequalities. Set government a big target, so every government department has a responsibility to improve health. Every government department has a responsibility to improve mental health. So yes, it's going to be a big part of our strategy coming out of this pandemic, because I do fear we're going to face a mental health crisis as well. Excuse me, the increase in we've seen antidepressant prescriptions go up after lockdowns at record levels. There's evidence of more people abusing drink as a result of isolation, more people expressing suicidal thoughts and thoughts of self-harm post lockdowns. I think we're facing a real mental health crisis, and we need to ensure that we've got a big plan in place to deal with it.
Yeah, and as GP, Jonathan, I've seen a lot of that in my day-to-day practice, and it's good to know that that will be a priority. I'm going to turn to Jan Burnell, who will be transported in. And in the meantime, I'm going to read out 2 questions from 2 different participants. The first one is from Karen Warpton, and her question is around learning difficulties. She states that people with learning difficulties have been largely forgotten. Information is not provided in accessible form, with a small number of exceptions. She goes on to says that she believes that there's a national MenCap campaign seeking to advocate on this issue. Where does learning difficulties and supporting people with learning difficulties come in terms of the wider Labour plan and agenda? The second question comes from Susan Lord, who asks, can Labour prevent the Tories blaming the NHS for this current crisis and prevent the Tories from using it as an excuse for further privatisation? And I'm going to now turn to Jan, who we can't see her video, but we do have her audio. Jan, could you ask your question?
Sorry about the video, probably does as well. I wanted to ask about social care. When you're elected, how will Labour integrate health and social care so that a sensible system works for everybody? And what role will local authorities play in that integrated system? Thank you.
Right, so these are good questions. I just noticed that Paul Richards put in the chat box that we already answered his point, so you don't need to bother asking his. I'm intrigued to know what he was going to ask now. So some really good questions here. We cannot allow the Tories to blame the NHS for this crisis, and I don't think the British public will let them, because the British public are seeing, not only have the British public applauded our NHS staff on their doorsteps throughout this campaign and put rainbows in their windows, it's the NHS who are vaccinating the British public. And although, look, the vaccination programme at this stage is always going to be a bit sort of stop-start in different parts of the country while we're waiting for supply to come online. But I think when people are vaccinated by their local doctor, their local GP, or by nurses at their local vaccination centre, I think the sense of appreciation for our National Health Service is immense. It really is immense. And I don't think the public will allow the Tories to blame the NHS. And actually, what has been one of the biggest failures of this crisis was when the Tories got the private sector involved. I mean, Serco contact tracing has been abysmal. You know, we've all said to them that you should use the experts who are trained in infectious disease control to do your contact tracing. Use your public health directors and their public health teams. They do this work. They do this work when there's a whether it's a sexual health infection outbreak or whether it's a salmonella, something like that. These are the experts on the ground who do this work. But the Tories insisted on employing Serco call centres and Citl call centres to do this work, and it failed. I mean, that is what happens when you get these big private sector outsourcing firms involved in the delivery of health and care services. It simply doesn't work. So I don't think, we've got to remain vigilant and continue to campaign. We cannot, I mean, Susanna says, means privatisation by stealth and outsourcing. Well, we've got to remain vigilant against that. And we've got to continue to highlight it. And it's why I've always said that, when you look, this sort of begins to answer John's question in a way. When you look at what we need to do in health and social care, when we need to respond to the demands of this ageing population and the demands of a society where there's health inequalities and a greater burden of chronic conditions, you've got to have better health and care integration. But the only way you can do that properly and not in a wasteful way is do it through the public sector. You cannot do it through private sector organisations like Virgin Care or whatever. Which brings me to the point about, social care, and this is a big debate. And Liz Kendall, who's our sort of social care minister, is doing some work on this about how we deliver that integrated health and social care model. Yes, it has to be based on partnership between the health service and the local authorities. The local authorities have always delivered social care. It's been called different things throughout the last 70 odd years, of course, but fundamentally they've always delivered social care. And the problem at the moment, of course, has been they've also had to deliver social care and contend with multi-billion-pound cuts over the last 10 years, which inevitably has meant that eligibility criteria have had to be squeezed as well. But we want to deliver an integrated care service where health and social care work in partnership. The question is, what is the right model to do that, and how do we get there? And I think that is something about that is an issue that we are going to be debating or discussing across the Labour movement in the coming years. But we absolutely have to go to the general election, and have to go into the next general election with a fully worked out plan on that front. And on the learning disabilities point, this is really important. You're actually seeing now. Well, not seeing now. We went into this crisis with terrible neglect of those with learning disabilities, and quite frankly, scandalous stories, particularly of young adults locked away for weeks and weeks in often poor private sector providers poor private sector mental health providers, often locking away young people with learning disabilities, with very severe levels of autism, locking them away for weeks and weeks and weeks. It's an absolute scandal. It's like something out of the Victorian era. It's absolutely unbelievable that it's been still going on or maybe it's not unbelievable, but it ought to be unbelievable that it's still allowed to go on in 21st century Britain. And not only did we go into this crisis with this scandal unchecked, we know that those with learning disabilities have been particularly vulnerable to COVID and that have a disproportionate mortality rate as well. So I think we've got to completely change the way in which we support those with learning disabilities. The way locking away young people that we've seen has to come to an end. It's a criminal scandal in my view. And you're right to raise the campaigns by MenCap and others and to say we are very aware of this issue and we will continue to be raising it and pushing ministers on it.
Thank you, John. And we're going to do a sort of final round of questions. We're going to bring in Adam Fife with audio and or video. I'm going to read out a question from Wymesh Thanky, and I'm going to also ask a question of my own. So Wymesh Thanky's question was around arrivals into the UK from abroad, potentially bringing in COVID-19. And his question is, why didn't Labour demand closure of borders straight away, like New Zealand closed theirs back in March 2020? So that's Wymesh Thanky's question. And Adam, could you ask your question, Adam?
Yeah. My question was, how can the NHS and the government as a whole focus more on preventative medicine? Because I think too often, especially in mental health, issues are left for far too long until they become bigger problems, which are more expensive to fix and have already caused more harm.
Thank you, Adam, for your question. And my question to you, Jonathan, is we've been through a very, very difficult year. And, we've seen huge curbs on our civil liberties, not being able to see family and friends. What makes you positive about 2021?
Okay, that's a good question. Okay, so on the first one, on the borders, well, I mean, I do remember back in March raising questions of ministers about the borders, where we had the peculiar situation back in March when it was a Liverpool Atletico Madrid match, where because the match was played in Liverpool, that Madrid fans could get on a flight from Madrid to Liverpool and watch the match. But if it was the reverse leg, Liverpool fans could not get on the flight to Madrid and go to Madrid and watch it. I was making the point that Spain had different controls in place to what we had. I also raised the point. I have raised the point in the House of Commons that it seems very curious that you've got Priti Patel, a politician who's campaigns for Brexit on the grounds that she wants to take control of borders and has monumentally failed to take control of borders when we're in the midst of a global pandemic which has spread across the world with severity. So we have made these points in fairness. On prevention, this actually absolutely speaks to this argument that I'm making about why we need to tackle health inequalities, and you've got to confront the wider societal determinants of ill health. So you've got to invest in preventative measures. I mean, the public health budgets have been slashed. Our health visitors, our school nurses have been cut back. You've got to increase the investment in public health. But you've also got to do more across society as well to improve people's health. You've got to deal with sugar and salt. We've got to have. The government are now finally moving on this. So, we'll see when it actually happens. But you've got to reduce the sugar content of, milkshakes and things like that. They've done fizzy drinks. They've got to go on to milkshakes. We've got to have clear standards. The amount of salt that's in food. I mean, the government watered down a lot of the previous Labour government standards around salt content. The debate is all about sugar now in the newspapers, but salt kills as well because of heart disease and blood pressure issues. So there's a whole load of preventative measures that we have to implement. and which the last Labour government was doing. And this Conservative government rode back on a lot of it. They rode back on the health inequalities requirements that we had, and the last Labour government was narrowing health inequalities. Our investment in Sure Start, the IFS found this. Our investment in Sure Start found that children's admissions to A&E came down because of our investment in Sure Start. We actually increased the number of family doctors in the poorer areas. That has been reversed under this Tory government. I mean, I've focused a lot on societal pressures which are driving ill health. One of the other health inequality scandals is access to healthcare. And you're more likely to see a GP if you live in a better off area than a poorer area, because of the way in which the funding mechanisms have been changed. So these are things that have to be tackled. We have to put in place health provision in poorer areas, because if you don't, it will lead to poorer health outcomes. And you have to ensure that you're taking measures to improve people's health across society. And on what am I optimistic about? Well, I am by nature an optimist, about human beings. And I am a great believer that progress is always made. And yes, there are setbacks. And, as Tony Benn used to say, who, for a lot of his career was a Fabian, even if he wasn't necessarily a Fabian in the later period of his career, always used to say that, there's never final victories or defeats. You've got to keep going. And that is what we have got to do. We've got to keep going. But the reason why I am hopeful, is that look at what is delivering the light at the end of the tunnel for us. Yes, it is the great scientific endeavour of research and our life scientists based on what is going on in our universities, but it's also a national health service which was created by a Labour government and still today embodies our values, that it is there equal for everybody, based not on your means and not on your ability to pay, but is free for all. It was that great civilizing moment, my Bevan said in 1947 when he was putting the legislation in place. And it does lift the shadows, and the shadows of this pandemic will in the end be lifted by that national health service. So I am hopeful for the future, and I do believe that we will get a Labour government at the next general election. And when we get that Labour government, we will lead an all-out assault on health inequalities, on putting in place the measures for people's health and well-being to flourish both here and internationally as well. So thank you.
Thank you, John. And I just want to, extend our thanks, for the work you're doing in your brief as Shadow Secretary for State for Health in such a difficult and demanding time. Thanks for holding the government to account, and thank you for the work you're doing. And now I'm going to turn over to Andy, who's going to close the conference for us all.
How many times have I done that? Thank you, Martin, and thank you, John. That was John's addressed Fabian Conference several times, many times. And I think that was the most stirring performance we've seen, and so uncommanded of the detail of his brief. He really will be a fantastic, not a shadow health secretary, a real health secretary very soon. I just want to end the session by thanking all of you for your contributions throughout the weekend. Fantastic delegates. It really has been a conversation, thanks to this platform as well, and the technology providers we worked with. On behalf of the Fabians, I'd like to thank FEPS, our partner in delivering this conference, as with so many. And I think the richness of the conversation of involving so many voices from outside the UK, from across Europe, has just shown that we are not an island. Whatever's happened through Brexit, we continue to have our partnerships and our friendships across Europe. But the people I particularly want to thank are firstly our amazing speakers. And John, if you'll pass on our thanks to all your shadow cabinet colleagues who have made this such a fantastic debate with the Labour Party all weekend, and to the team organising the event, the fantastic staff at the Fabian Society and at FEPT. It really is, to pull off something like this, particularly doing it all for the first time online, a massive team effort. But if you will just use your claps in the comment bar for one person in particular, the lead organizer of the conference was Katie Curtis, and she has done the most amazing job in making this all happen and keeping everyone else in train and helping with tech support problems and with booking these amazing speakers and bringing us all together. So thank you huge amount to the whole Fabian Society team and the FEPS team, but particularly to Katie. I hope we don't have to do this conference again. I hope we'll be meeting as friends in person, face to face, but we know that the Fabian Society's debates can continue, pandemic or no pandemic, and we will be seeing you all very soon, whether it's online or face to face. In the meantime, please do consider giving a little bit extra to the Fabian Society if you're in a position to, by joining our donation scheme. You can find that on our website. And if you've enjoyed this weekend, tell someone else about the Fabians. We'd love to have more members. If everyone on the call recommended someone to join the Fabian Society, it would be a wonderful boost. And we will see you all very soon. Thanks for your contributions.